Hello, this is Maryellen Boyce, dietitian with True Pace. I am here today to talk to you a little bit about hydration in older adults. My presentation is called Drink to Your Health. So to start off today, I want to give you a few questions to get your mind thinking. What percentage of our body is water? So think about that for a second. 60%. So I don't know if you went higher or lower, but this number actually does change a little bit as we age. We have a lower percentage of our body as water. So infants and children have quite a bit higher percentage. Next question, how long can you live without water? Probably get a little bit closer on this one, I would imagine. Most people know that it is approximately 3 days. So there is a rule of 3, which is that you can live about 3 minutes without oxygen, 3 days without water, and 3 weeks without food. So that's about as long as you can live without water is 3 days. So let's talk a little bit about why hydration is important. So hydration is important in many processes in the body. We use water for a lot of different things in our body. Thermal regulation would be using water to regulate our temperature of our body. Water is also important in biochemical reactions and metabolism, meaning that sometimes water is needed and sometimes water is produced as part of these metabolic and biochemical reactions in our body. And also water is important for waste removal. Both for our urine and for our feces, we need to have water to help remove those wastes out of our bodies. It is the most essential nutrient in our body, honestly. So hydration is especially important in older adults because it is really much more difficult to detect thirst when you get older. And there is less reabsorption of water in the kidneys as we age. They become less efficient about reabsorbing some of that water back into your bloodstream. And dehydration can actually have more severe health complications as we age as well. So it is important that we pay more attention or be more intentional about hydrating as we get older. So dehydration can happen, obviously, when we don't drink enough, but it also can happen for other reasons, like perhaps sweating too much, loss of blood, or vomiting and/or diarrhea can also cause dehydration. Dehydration is associated with longer hospital stays, more intensive care, or ICU admissions, readmissions to the hospital, and overall poor prognosis. So dehydration is usually present in about 37% of older adults who are admitted to the hospital and 31% of older adults who are living in a skilled nursing facility. So about a third of those at-risk population is going to be dehydrated. So here are some signs so you can be aware of dehydration. Now, I just want to let you know here up front that a lot of these signs and symptoms are associated with other things too. So they do not necessarily mean that you're dehydrated. But if you have several of these together and you realize that you haven't drank for a while, then it may be because of dehydration. So let's review them briefly. Headaches and dizziness. This is something that I often tell my children when we're outside for a good portion of the day or on a hike and they complain of a headache. Have you drinking enough water? Or drink some water and we'll see if the headache persists and continues. Dry skin, lips, and mouth. Of course, some medications can give you a dry mouth feeling as well, but overall, those things can be a sign of dehydration. Tiredness, irritability, and moodiness. Well, of course, this is not exclusive to dehydration as well, but combined with something like muscle weaknesses and cramps, reduced urine and sweat production, low blood pressure, frequent urinary tract infections, and memory loss and confusion can all sort of be signs or clues that you may have dehydration. So I want to talk a little bit about our body water balance. This is a graphic here that can show us where we get our water and where we lose our water every day. So let's just briefly talk about the right side of this table first, your water outputs. Where do you lose water from? Well, you can lose water from sweat, and that's really variable as to how much you sweat a day. But there is a little bit that is lost in your sweat, as well as in your feces, your bowel movement. You do lose some water there, not a lot, but some. Urine, there's quite a bit of water lost in your urine, as you can see, 1 to 2 liters. And also we have almost as much in what is called insensible losses. So losses that we may be breathing out water as we exhale, or we just lose water off of our skin as part of our just day, not necessarily dripping sweat, but just we lose that sort of water through our skin. So let's talk a little bit about where we get our water. So we do get a little bit of water from some of those biological and metabolic processes. So that would be through, it says transcutaneous respiration, or through our skin, metabolic water, which was what I was just talking about. And then we have water ingested in food and water ingested in fluids. So usually 2 to 3 liters in fluids, and a half to a liter is actually in our food. So you can see how we really want to try and balance these inputs and these outputs, right? If we're doing something that causes us to sweat a lot, then we need to, or perhaps we've lost some with diarrhea or vomiting, then we need to put more into our body, right? And if you look down at the bottom, you can see that our total body water is about 8% plasma, 27% interstitial fluid, and 65% intracellular fluid. So what's inside of our cells and what's between our cells is the difference between intercellular, inside the cells, and interstitial is between the cells. So our body is really set up to manage the system well. So if we're becoming dehydrated, we should have a decrease in blood volume, which will cause our kidneys to notice that there's a lower amount of blood, and it sends a hormone to our body to increase sodium absorption, which will increase water absorption. So water follows sodium as part of like osmosis. If we have more sodium in our blood, more water will flow into the blood vessels to balance that out. So if we have plenty of water, that turns off, and we don't reabsorb sodium, and we put more urine into our bladder. So hopefully that makes sense. If we start to feel really thirsty, we're probably actually already experiencing some dehydration and have lost about 2% of our body weight, which is the clinical level for dehydration. So that's kind of the processes in the body for managing water balance and for allowing us to know when we need to drink more water. But like I said, as we get older, we're less aware of that process. So we have to be more intentional. Here are some of the benefits of adequate hydration. So when we are adequately hydrated, we have a healthier skin and better body temperature regulation. We have improved kidney function and reduced urinary tract infections. We have improved metabolism, which may reduce our risk of diabetes. That improved metabolism, there's been some studies that show that. Improved cognitive function, concentration, alertness, and memory. Improved gut function, because it prevents constipation and improves the gut microbiota. So those are just a few, but really positive things come from hydrating. So how much should I drink a day? So you really should drink about 1/3 of your body weight in fluid ounces a day. So if you weigh about 150 pounds, then you need about 50 fluid ounces a day. Generally, 8 cups a day is what's recommended for most people. So that would be about 64 fluid ounces. So that gives you sort of a roundabout ballpark figure that works for most people. I just want to note here that some medical conditions do require fluid restrictions. So if you have kidney problems or congestive heart failure, you do need to follow the recommendations from your doctor to not overhydrate, because that can be very bad if you're suffering from some of these conditions. And also keep in mind that you do need to increase your fluid intake in the summer months when it's hot, when your activity level is higher, when you've been sick with a gastrointestinal upset. So think about that as well. So how do you know if you're drinking enough water? Well, there are a lot of clinical ways to determine. We can do a blood draw and see, how concentrated your blood is and those things. But athletes often measure fluid loss by weighing themselves before and after an event. But that's not very practical for most people either. So what we like to use in, everyday sort of terms is to check the color of our urine. So this is just a sort of ballpark figure. The lighter the color of your urine is, generally the better hydrated you are, right? You don't want it to be completely clear because you can overhydrate. It's uncommon, but it can happen. So you want there to be just a hair of color there, but you want it to be quite light. And so the darker the urine gets, the more concentrated it's become and the more dehydrated it is. So if your urine looks a little bit like apple juice, you need to take some water, a lot of water. You're quite a bit dehydrated. So that's something that you can look at and just sort of keep a tab on how hydrated you are based on the color of your urine. Also, low urine output is an indicator. So how often you pee may also be a sign for you. So keep that in mind as well. Do all liquids count? Well, most fluids are mostly water and they will hydrate you. So yes, most fluids do count. But you do want to try and stay away from sugary beverages. They're just not healthy in general. And there are a few notable exceptions to this about liquids counting for hydration. Both alcoholic beverages and caffeinated beverages do not hydrate you. It causes you, it's called a diuretic. So that means that you will actually pee out more fluid than you take in with those beverages. So keep in mind that you can still have those things, but they don't necessarily hydrate you when you do have them. So just keep that in mind. If coffee is your number one way of hydrating yourself, you may need to choose something else instead to drink or in addition to become hydrated, to remain hydrated. Okay, so here's some tips. You can add flavoring to your water that can make it more desirable to drink your water. Set reminders on your phone or your calendar when you should drink. Include it in part of your routine. Like maybe you want to have, every morning before you get dressed, you have a glass of water. You've put it into your routine in a set space that helps you to remember it. Get a water bottle and fill it up every morning and take it with you in the car or where you're ever about your business, have it close. And that encourages you and reminds you visually to drink. Drink water with meals or a full glass before meals. Sometimes it's tempting for some older adults to avoid drinking before bed or before going out because of issues with incontinence. That's really quite common. You still need to make sure that you are getting enough fluid, even if that's the case. So it can be really challenging, but you do need to be intentional. Oh, I want to get most of my fluid in the first part of the day. Or perhaps I'm not going to take as much fluid in the morning because I'm going to go to an appointment later. I'm going to make sure I drink more fluid after the appointment. So you've got to be conscientious about making sure you do get them if you exercise some of those strategies. Also, some people may have troubles with mobility, getting up and getting themselves a drink or carrying around a water bottle. So make sure you ask others to help you if you do need a little assistance with that. And I'm sure, just taking the initiative to ask will hopefully not be problematic. I want you to think just a little bit more about that. Even write down or put a note in your phone what works for you to drink more water. What things can help you to remain better hydrated every day? And make one goal for yourself. What can you do that can help you? If you would like help or assistance with becoming and maintaining better hydration, you can always reach out to your TruePace dietitian who can help work out a hydration plan that works for you. Additionally, if you have questions about hydration with your specific medical needs and conditions, also reach out to your TruePace dietitian. Here is a reference that I used in my presentation if you're interested about some of the current knowledge and challenges with hydration status in older adults. Thank you so much. Have a good day.